Speak to the first reading of the New Zealand Public Health and Disability Amendment Bill. The bill proposes legislative amendments necessary to support reforms recommended by the Ministerial Review Group earlier this year. Importantly, Mr Speaker, this is not about major restructure of the health system, it's about trying to get the health system working. The health sector has been struggling. We've had 21 DHBs doing 21 different ways, duplication, working inefficiently and reinventing the wheel 21 different ways. One of the provisions of this bill is to provide shared administrative support and procurement services across the public health system, including additional powers such as ministerial direction to enhance ministerial ability to require greater system collaboration and use of shared services. The Minister has already made a number of changes to help improve the way the health sector works. The Minister introduced 6 health targets so DHBs could focus on the urgent issue of reducing excessive patient waiting times in public hospitals, more elective surgery, faster cancer treatment and shorter waits in emergency departments. The Minister has been concerned about our health workforce. Too often we seem to be a training ground for Australia. New Zealand has had a health workforce crisis with too many clinicians disengaged and leaving the country. The Clinical Training Agency Board was established to unify workforce planning in New Zealand and ensure coordination of workforce training, planning and funding for our nurses and doctors and other health professionals. The Minister has also gradually increased the number of appointed DHB members who sit on more than one neighbouring board, particularly with people with health and financial expertise. Mr Speaker, the Ministerial Review Group report was a landmark document. It recommended how New Zealand might improve the quality and performance of the public health system. It was a comprehensive report with 170 recommendations on how to reduce bureaucracy, improve frontline health services and improve value in the public health and disability sector. The report recognised that to improve frontline services we need more input from frontline staff, and there were recommendations to strengthen clinical leadership and clinical networks. The report proposed consolidating back office functions across 21 DHBs to harness the power of bulk purchasing. It was also proposed reducing the number of committees that advise the Ministry of Health from 157 to 54. Mr Speaker, the Minister is right on track with the report's recommendations. This bill is about ensuring that the momentum continues. Mr Speaker, the proposed changes represent a major drive for better value for money in our public health sector and will enable greater national and regional cooperation in the sector and reduce duplication and bureaucracy. These changes will enable us to improve efficiency and move more resources to the front line. Mr Speaker, I commend this bill to the House.
The question is that the motion be agreed to. Those of that opinion will say aye. The contrary opinion will say no. The ayes have it.
New Zealand Public Health and Disability Amendment Bill, first reading.
Mr Speaker,
Call the Honourable Tony Ryle.
I move that the New Zealand Public Health and Disability Amendment Bill be considered by the Health Committee.
Members, the question is that the motion be agreed to. Those who are of that opinion will say aye. The contrary opinion will say no. The ayes have it. I now call upon Government Order of the Day number 4.